Hey guys, I'm Dr Hamid Al-Hassiny. I'm the director of the Institute of Digital Dentistry, and I run our live patient implant surgery mini-residency here in our clinic in Wellington, New Zealand. I want to walk you through exactly what this course is, what the 2 days look like, and how to know if it's right for you. Because here's the thing, most dentists who have come to us have done some form of implant education already. They've done the theory. They might have done a few pig jaw courses. They understand the prosthetics because they've been restoring implants for multiple years, but they haven't placed one implant in a real patient yet. Or they've done a handful and still don't feel confident doing it consistently. That gap between knowing and doing is exactly what this course is built to close. Over 2 days, you will place a minimum of 8 implants on live patients in our clinic. Many of our attendees end up having placed 10 or even 11. You'll work across a range of case types, anterior teeth, posterior teeth, guided placements, and freehand if you wish. Some cohorts have also had immediate placements and even some minor sinus lifts, depending on the patient scheduled for that week. Every case is pre-planned by our clinical team with a surgical guide, and every patient has been vetted and consented before you arrive. You're not spending time on admin or planning logistics. You walk in and you operate. You'll have either myself or my father, Dr. Ahmad, right there with you, the same person who taught me. The mentor ratio is 1:2, so there's always experienced hands available. We're not watching you from across the room. We're right there beside you. When you need help, we step in immediately. When you're doing well, we step back and let you work. You also get a dedicated dental assistant for the entire 2 days. These are our personal DAs who do this every day with us. They know the kits, they know the workflow, and they're there to support you. So the only thing you need to focus on is doing the surgery well. Day 1 starts with a short theory refresher in the morning. Then you're into live surgery from 10 to 4 or 5. We break for case discussion at the end of the day. And then we all go out for dinner at one of Wellington, New Zealand's best restaurants. Day 2 follows the same structure. At the morning, we are going to do a case review, then back into surgery. By the afternoon of day 2, something interesting always happens. You've done this enough times now that it starts to feel familiar. The nervousness that I always see from day 1 has been replaced by rhythm. That's the shift every attendee talks about, and it's the reason this course works. Confidence doesn't come from more and more study. That's important, but it comes from hands-on repetition, and that's what we give you here. The course is capped at a maximum of 6 attendees, and we only run 2 cohorts per year, in June and October 2026. Everything is included: catering, hotel pickup and drop-off from our partner accommodation, Seabill Lower Hut. A full online implantology course bundle is also included, with 18 courses and 34 hours of CPD. Lifetime access to our alumni WhatsApp group and ongoing support from our team as you tackle your first cases back in your own clinic. If you're comfortable with surgical extractions, raising flaps, and suturing, you're ready for this. The rest, we will teach you. Have a look through the rest of this page. Read what past attendees have said, and if you've got questions, book a call with our team. We'll give you the straight answer if this course is the right fit for where you're at. I'll see you there.